Hi, my name is Olivia Roberts, and this is my Sport and Exercise Science interdisciplinary presentation. So the slideshow will contain two main parts. The first section covering the infographic and the literature used to inform it, and then the second part will focus on the personal action plan that I was also required to complete for this module. So looking at the infographic, you can see that I've split it up into four main sections. What postnatal depression is, what are some of the common symptoms of postnatal depression, some key facts and statistics surrounding postnatal depression, and finally, the potential treatments and coping strategies for postnatal depression. The top three sections were predominantly informed by the articles written by the NHS and the Royal College of Psychiatrists. However, nearly all the sources I read included a brief overview of what postnatal depression is and some common symptoms found within it. It's also important to note that, although postnatal depression is a psychological disorder, the symptoms experienced by individuals can be both mental and physical, which supports the need for an interdisciplinary approach towards the types of treatment and coping strategies used. The bottom section identifies the various physiological and psychological treatments or coping strategies which can help to manage and potentially decrease the effects of postnatal depression. Focusing on the physiological aspects first, regularly exercising or taking antidepressants have both been of great interest to researchers for their effect on reducing postnatal depressive symptoms as well as other psychological disorders such as anxiety. The first source which informed my infographic was the meta-analysis produced by Molyneux et al. 2015, which compared the effects of antidepressants and placebos on postnatal depressive scores. It highlighted that in 3 out of the 4 studies analysed, the postnatal depressive symptoms for the individuals taking the SSRIs or the antidepressants reduced by at least 50% after the 6 to 8 weeks of treatment. It's also important to note that 2 out of these 3 studies who identified a reduction in postnatal depressive symptoms also utilised some form of psychotherapy alongside the antidepressants, which may have affected the participants' response rates to the SSRIs. The second key source I utilised was the review article produced by Mikkelsen et al. 2017, who recognised the positive effects of exercise on mental health disorders through physiological mechanisms. For example, the endorphin hypothesis, first proposed by Harbour and Sutton in 1984, suggests that exercise acts as a catalyst for the release of endorphins in the brain, which increases mood and feelings of euphoria, often referred to as the runner's high. Mikkelsen et al. 2017 also argues that exercise as a means of coping with depression has been reported to have more of a positive influence on the management and reduction of depressive symptoms compared to the use of introspective or self-focused activities such as keeping a diary. However, due to the methodological difficulties and lack of attention stopping these theories from being investigated, there is little evidence to either support or refute most of the theories Mikkelsen discussed. Now focusing more so on the psychological aspects, psychotherapy such as cognitive behavioural therapy or interpersonal therapy, as well as introspective coping strategies such as keeping track of progress in the form of a diary, have all been said to manage and reduce the effects of postnatal depression. Another key piece of literature that informed the infographic was Milgram et al.'s 2015 research comparing the effects of antidepressants, cognitive behavioural therapy, and combined therapy for women with postnatal depression. This study specifically highlighted the huge importance and benefits of an interdisciplinary approach to research. Milgram et al. 2015 reported that, although the cognitive behavioural therapy group was found to be superior to the sertraline group after the 12 weeks of treatment, the combination group utilising both sertraline and cognitive behavioural therapy had significantly greater reduction in postnatal depressive symptoms than the other 2 monotherapy groups. However, it should be noted that despite 6,500 women being initially screened for the study, only 45 women were chosen for the final sample. As they utilise such a small sample size, the generalisability of the results reduces, as the selected women in this study may not have represented the wider population. O'Hara et al.'s 2019 research study examining the comparative effects of sertraline, interpersonal psychotherapy, and placebos was also used to inform the infographic. They found at the end of the 12 weeks of treatment, participants in both the psychotherapy and sertraline groups presented up to a 40% decrease in postnatal depressive symptoms, with no significant differences being found between the 2 groups. This suggests that the psychotherapy was just as effective as the antidepressants utilised. In addition to the treatment, participants were also asked to keep diaries as a self-report measure to track their feelings and progress. Participants were also asked in the final interview whether or not they felt keeping this log gave additional help during the trial, which 36 of them answered yes to. However, as no control group just utilising the self-reporting measure was utilised, we do not know how effective this strategy would be independently. Now moving on to the action plan portion of the presentation, these are some of the key competencies I've developed during my time as a sport and exercise science undergraduate student. So in regard to 1.1 and 1.2 of the BASIS competency framework, over the 3 years of study, the SES course has progressed my knowledge massively in terms of both performance and health-related physiological concepts. This is also reflected in my grades over the 3 years, starting on an average of 58% and finishing with a score of 82% for the module overall. This in-depth and advanced physiology-based knowledge has given me the opportunity to study SES at a postgraduate level, bringing me one step closer to securing a job within clinical physiology. Another key competency that I've developed over the years are my IT abilities. Several of the SES modules have required me to gain a high competency level in a range of IT programs, including Vicon, SPSS, Qualtrics, and even Excel. This progression in my understanding and appreciation for these IT programs have allowed me to produce in-depth pieces of research, such as my dissertation, and given me a solid foundation of knowledge of the relevant softwares I can take forward with me into postgraduate study. Finally, in reference to 8.2 of the BASIS competency framework, I've shown a steady progression in all the module areas over the 3 years, which highlights the immense pride and responsibility I take in my own personal improvement and professional development. Reflecting on previous assessments has allowed me to see how far I've come in terms of my knowledge, understanding, and competency levels, which motivates me to further this development at a postgraduate level. Now looking at the areas that still need further improvement for my professional development and future career choice. 2.5 and 3.5 refer to both my practical skills as well as my abilities to apply my knowledge and understanding of key concepts within a practical setting. Practical seminars have always been something I've struggled with, either not being confident in applying my knowledge or not being able to utilise equipment or follow procedures fully without additional help. A few things I will do to progress my practical capabilities and application of knowledge by the time I finish my postgraduate studies will be to attend additional workshops based around improving and refining my practical skills, as well as completing work experience within a professional sports science setting so that I can begin to develop confidence within a live context. Another competency that I've struggled with throughout my time at university has been my ability to communicate effectively. From the age of 3, I've had a highly noticeable stammer and had to attend speech therapy as a result. I've always been pulled up on how coherent I am when explaining something, and because of this, I found what some people might find quite easy, particularly challenging, such as oral examinations, presentations, and coaching sessions. Some key things I would do to progress and maintain both my verbal communication skills and sports science-based vocabulary by the end of my master's will be to keep attending my speech therapy sessions and reviews, as well as challenging myself to speak in large social or academic situations. 8.7 of the BASIS competency framework refers to my understanding and compliance with the relevant code of conduct. From working as a supply teacher and tennis coach over my time at university, I've learnt the code of conduct and professional guidelines I must abide by in relation to the safeguarding of children and standards of teaching. As I'm still an undergraduate student, I've had very little experience in a professional sports science setting and therefore have limited knowledge and understanding of the BASIS code of conduct for sport and exercise scientists. To develop and maintain an advanced understanding of the BASIS code of conduct by the time I finish my master's in September 2021, I will access and read the BASIS code of conduct, as well as utilising this newfound knowledge and understanding within a practical sport and exercise science work experience environment. And finally, in regards to 10.7 of the BASIS competency framework, besides working within the NHS on an incident reporting programme, I've limited knowledge into the health and safety legislations or incident reporting policies enforced within a professional sports science context. Some of the things I will do to develop this competency by the time I finish my postgraduate studies will be to develop an understanding of the relevant health and safety legislations and incident reporting protocols for my area of expertise, as well as completing work experience within a practical sport and exercise science setting where personal initiative and decision making is often required. In summary of all the content covered within this presentation, for the infographic, based on all the literature discussed, it has highlighted the importance for an interdisciplinary approach to treatment for postnatal depression, utilising both forms of psychological and physiological strategies to maximise the response rates of all interventions used and ensuring holistic development within the individual. In regard to the personal action plan, although I have a solid foundation of knowledge and understanding for several of the sport and exercise science modules, my communication skills, my confidence in applying my knowledge and abilities within a practical setting, as well as my knowledge of the relevant codes of conduct and safety policies, still needs a lot of work for my own personal improvement and professional development. Thank you very much for listening.